question around caring versus caregiving. I think in nurse midwifery, I see that there's a difference in caregiving, but there's not a difference in caring. So in caregiving, I believe that it looks very, very different depending on the population that you're serving. So if you're serving maybe the elderly or the children, even infants, I think caregiving means that you're caring for their needs. But if you're caring or being a caregiver for healthy pregnant women as a nurse midwife, that would be my population, but also healthy adults or even older teens, I think the caregiver is actually the person that gives you the knowledge that you need to know, and then you improve your health and learn how to take care of yourself. So the word that comes to mind is empowering people to care for themselves rather than caring for them. I think caring applies to everyone in nursing and all healthcare, especially when you're dealing with difficult procedures, maybe procedures that people are consenting to, but they wish they didn't have to have, those types of things. And it really goes back to wanting the best for our patients. And so if that means that we're holding their hand and giving them words that they need to hear to get through the procedure, then I would say that that's the way that we care for them the best. So I think that caring has evolved for my practice and for my profession as a nurse midwife from the time that I was a novice to hopefully an expert now 25 years later. And so when I was a novice nurse and a novice nurse midwife, I think that caring was more of a thing that I needed to do because I knew that the person was suffering, but I was more concentrating on the skills that I needed to do whatever it was that we were doing well, because I didn't know what those skills were. I was just learning how to master those skills in the beginning of both being a nurse midwife and a nurse. And so I think I cared for folks, but I didn't care for them into the level that I care for them now. And it's because skills now aren't the forefront of my mind. Skills are second nature because I've done them over and over and over again. And now, because I've done them over and over again, it's easier to care for folks at a much deeper level and to hear them. So I think that being a caring person and performing skills on patients also goes along with having experience. And so I'm thinking specifically of a woman in labor because that's what I do most days. If I know how a typical labor pattern goes, now that I've been a nurse midwife as long as I have been, I can anticipate when labor is going to get really, really bad. And I can anticipate when women are going to have different sensations. And if I can prepare her for those things and remind her that this is a short moment in time and then you're going to be holding your baby and anticipate those things, I think that's part of caring for her and helping her deal with different circumstances in labor and get through them, especially women who want to do labor with very minimal pain management meds. They really appreciate having that anticipatory sort of guidance along the way. And now I can only imagine that in the next couple of minutes, things are going to get really, really intense, but then it's going to be over. To know that before it actually happens helps you prepare for it.
When I hear that someone call a nurse a caregiver, I think of as the nursing nerd that I am. There's a theory by Gene Watkins called caring science is sacred science. And we provide care as an act of servitude to our patients. And while people say, well, you're the hands and feet of Christ, or we're a servant, we really are. But also that caring is what provides us with a window into that patient's experience in the hospital or in whatever setting they're currently in. We're able to partner with them and help them advance through their illness, whether that's getting them to a place where they can go home, whether that's passing peacefully. And as a pediatric nurse, caring means not just my patient in the bed, but also their family. How do I care for the parents or the caregivers who have a sick child? How do I approach them in a way that's loving and also helps them understand the gravity of the situation, but at the same time partnering with them to fix the situation. So, so when I think of caring in my own profession and how I practice, I think of that as providing developmentally appropriate care. So whether that's swaddling the baby to help them stop crying and providing non-nutritive sucking or a pacifier, or is it the teenager walking them through the process, or letting the school-age child play with the apparatus or the IV or something like that before we do anything to get them more comfortable with it. Those developmentally appropriate cares that we call them, or our comfort promise at Children's, is more of a way to make sure that that patient's comfortable, but that's also caring. So when we think about a child at home, we hope that their parents care for them, and we hope that they provide that care. So when they come into the hospital, I try to be like their parents in a way of providing care, being someone that they can be comfortable with. When it's a toddler, that doesn't always go well. Sometimes they don't want to see me, but eventually, by being that calm, caring presence in the room, they start recognizing that I'm okay because my parents are doing okay. So in nursing school, I thought caring was a care plan, which meant all these different nursing diagnoses and interventions and a process that I had to follow. When I got into nursing practice, I quickly realized that that was not the case. While care plans are a valuable learning tool, it wasn't what we did. Caring was deeper than that. Caring was entering a very vulnerable space with your patients to help them cope, and with their parents or caregivers to help them cope. Now, through 8 years of practice at the bedside in different units, I've learned that caring takes on a different form for every different patient, every different family, based on what they needed at that given time. So one parent could need something in the morning that needs something completely different in the evening. So I look at caring as an evolving process, something that always is changing and morphing to what is needed for that patient and that family based on what's going on with that patient at that period of time.
So caregiver for me it's kind of just simple. It's just being the hands and feet of Christ and acting accordingly with that. And then for caring, I feel like that one has a little bit more meaning behind it. It's essentially seeing into the heart of a person. And when you see into that heart of the person, it invokes a loving response. It's essentially, it's intention, it's compassion, and advocacy, and empathy mixed up all together, and there's meaning in it too. So this one actually has a very personal meaning for me. So when I was a junior in nursing school, I had to have a minimally invasive procedure done right before a big test. It's wonderful. But the nurse that I had just really touched my life, and I took a lot away from it. And so while this was happening, I was essentially face down, and so I couldn't really see anything going on behind me. But the doctors were just very focused on the case at hand and what they needed to do, and it was very, very painful for me, and I was screaming, and it was kind of traumatic in a way. But the nurse, all I remember what she did was that she was essentially stroking my left foot and just kind of stroking it, and it just provided so much comfort for me, and it made me feel seen and heard, and that I was in pain, and that she addressed that. And so I took that away, and that I realize I do that a lot to my patients as well. Whether they're sedated or they're awake and alert and they're going through something hard, I will just lightly touch my patient and just let them know that they're seen and they're heard. And often, I do this a lot, and just saying, "You're doing great, this is what we're gonna be doing, I'm so proud of you," just grabbing their hand and just encouraging them. I'm a huge encourager, and I love being able to do that for my patients and just see them smile. And the biggest thing is that they want to feel that what they're going through is horrible, but they're doing a good job, and that I'm there with you, and that they're seen. And so that's what I try to do, is just to be the hands and feet of Jesus, essentially, and just try to be able to provide that care and comfort for them. So caring, at the beginning, I wanted to do everything. I tried to feel everything, and I didn't care about me as much. I just tried to give everything, and eventually I just got very burned out, and I needed to find some boundaries and different ways of caring. And so I kind of stepped back a little bit. I still could care, but I didn't give everything, and I kind of feel less now. But I had some issues just being like, man, I don't feel like I'm as good of a nurse because I don't feel as much, but it's not true. I still provide a ton of care, and my patients are appreciative of that, and I've never received so many thank yous in my life from family members and patients too. And it doesn't make me a bad nurse because I'm feeling less. I'm still providing enough care, but I'm also providing self-care for myself as well. And finding that balance was essential because burnout is huge in nursing. And I feel like I still have a lot to learn from that, but it's an ongoing thing. I'm still going to keep learning how to care for my patients without not caring for me too.
When I think about nurse as a caregiver, it's just part of what nursing is. It's not necessarily everything that a nurse does. A caregiver can be anybody who knows how to take care of somebody who is in need. But when it comes to being as a nurse, as a caregiver, it's taking it to a different level, because yes, you're a caregiver, but you understand the pathophysiology. You understand the process. If the person is sick, the process of the disease process and the impact it has on the person, and how you can help them get better or live with the condition that they have. I have a mom who does not understand that she needs to breastfeed her baby a minimum of 8 times in a day, because it's important for the baby to be fed, and I give her everything. I come back and find the baby still asleep. I'm like, did you feed the baby? She'll be like, oh no, I did not. Say, oh, it's important that we do this because most likely this is a mom who her babies have history of jaundice, and it's very important that she maintains to make sure that she feeds them often, and so that we can flush out the belly. So if I come back as the first time, I say I will educate her, and the second time I'll come and educate her again. It's in my caring nature that will make me keep repeating it. But it gets to a time that if I come the third time and I help her feed the first time and the second time, and then the third time I come back and I ask the same question and she's not interested, my caring part is going to be like a tough love. But it's because I want her to learn that it's important for her to do the right thing for her baby. Many years ago, we did a lot of cares for the patients. We actually thought it was, I would just say for me, I thought, oh, if I did everything for them, it shows it's caring. But over time, that has changed, and we know that it's good for them to take care of themselves. It's part of holistic care for them to be able to care for themselves. Our work as a caregiver is to support them until the time when they can be able to take care of themselves.